Moyamoya disease.
Presented by Haleigh Myers and Kaley Lindsay. Moyamoya disease is also known as
cerebrovascular Moyamoya disease, Moyamoya disease, progressive intracranial arterial occlusion, progressive intracranial occlusive arteriopathy, and spontaneous occlusion of the circle of Willis. What is Moyamoya?
Moyamoya is a rare condition in which the blood vessels that supply blood to the brain become narrow. This limits the blood flow to the brain, which puts them at risk for a stroke. Moyamoya is a progressive condition, meaning that it gets worse over time, so patients need treatment to reduce their risk of stroke. Who is most at risk for Moyamoya disease?
Moyamoya disease is found all over the world, but it's more common in East Asian countries, especially Korea, Japan, and China. Also, having a family history of Moyamoya disease puts you at a higher risk. Moyamoya disease sometimes occurs in association with other disorders, including neurofibromatosis type 1, sickle cell anemia, and Down syndrome, among others. Being female has a slightly higher likelihood in developing Moyamoya. Though adults can have Moyamoya, children under the age of 15 are most commonly affected.
Up to 15% of Japanese people with Moyamoya disease have one or more family members with the condition, indicated that the condition can be passed through generations in families. However, the inheritance pattern is unknown. Research suggests that the condition follows an autosomal dominant pattern, which means one copy of the altered gene in each cell is significant to cause the disorder. However, some people who have a copy of the altered gene never develop the condition, which is a situation known as reduced Pinterest. What causes Moyamoya?
The exact reason why Moyamoya occurs is unknown, although researchers believe the higher concentration of Moyamoya disease in these Asian countries strongly suggests the disease may have genetic causes. Moyamoya is also associated with certain conditions, such as Down syndrome, sickle cell disease, neurofibromatosis, and hypothyroidism. The genetics of Moyamoya disease are not well understood. Research suggests that the condition can be passed through families and changes in one gene, also known as the RNF213 gene. It has been associated with the condition. Other genes that have not been identified may be involved in Moyamoya disease. It is also likely that other factors, such as infection or inflammation, in combination with genetic factors, play a role in the condition's development. The RNF213 gene provides instructions for making a protein whose function is unknown. However, research suggests that the RNF213 protein is involved in the proper development of blood vessels. Changes in the RNF213 gene involved in Moyamoya disease replace single protein building blocks in the RNF213 protein. The effect of these changes on the function of the RNF213 protein is unknown, and researchers are unsure how the changes contribute to the narrowing of the blood vessels or the characteristic blood vessel growth of Moyamoya disease. For unknown reasons, people with Moyamoya disease have elevated levels of protein involved in cell and tissue growth, including the growth of blood vessels, and An excess of these proteins could account for the growth of the new blood vessel characteristics of Moyamoya disease. It is not clear if changes in the RNF213 gene are involved in the overproduction of these proteins. Signs and symptoms of Moyamoya disease includes:
the first symptom of Moyamoya disease is usually a stroke or recurrent transient ischemic attacks, or TIAs, especially in children. Adults may also experience these symptoms, but more often experience bleeding in the brain, called hemorrhage stroke, from abnormal brain vessels. Other signs and symptoms include headaches, seizures, weakness, numbness, or paralysis in your face, arms, or legs, typically on one side of your body. Visual disturbances, difficulties with speaking or understanding others, called aphasia, developmental delays, involuntary movements, and cognitive decline. Diagnosis of Moyamoya disease.
To diagnose Moyamoya, your doctor will review your symptoms, family, and medical history. They will then perform a physical examination and may order several tests to diagnose Moyamoya disease and any underlying conditions.
Tests of Moyamoya disease may include MRIs, CT scans, cerebral angiographies, transcranial Doppler ultrasounds, SPECT scan, or EEGs. Treatments of Moyamoya disease include
medications such as blood thinners, calcium channel blockers, and anti-seizure medications. Surgeries and procedures such as revascularization surgery, direct and indirect. Complications of Moyamoya disease include
vision problems, weakness, language disturbances, movement disorders, learning or developmental issues, and seizures. Moyamoya disease versus syndrome.
Moyamoya disease is a rare neurological disorder involving the progressive narrowing of two of the major arteries, the internal carotid arteries, supplying blood to the brain. As a result of this progressive narrowing, a new network of small blood vessels are around the base of the brain in an attempt to compensate for the reducing blood flow. The appearance of this new network of blood vessels resembles a puff of smoke on cerebral angiogram, giving a rise to the name Moyamoya, from the Japanese expression for something hazy, just like a puff of smoke drifting in the air. In many instances, this new vessel formation is insufficient to compensate for the progressive occlusion and blockage of Moyamoya and blockage of the internal carotid arteries, resulting in transient or permanent brain damage. Although a high incident of Moyamoya disease is found in people of Asian descent, especially Japanese, it has now been recognized worldwide and in all ethnic groups, often more in females. Moyamoya syndrome, or secondary Moyamoya, is different from primary or idiopathic Moyamoya disease, as it develops secondary to an underlying disorder such as Down syndrome, Williams syndrome, sickle cell disease, or neurofibromatosis, or may often occur after brain radiation therapy. Moyamoya disease versus syndrome continued.
Moyamoya disease is a type of chronic cerebrovascular occlusion disease which frequently occurs in East Asian populations. including pediatrics and adult patients, and may lead to ischemic or hemorrhagic stroke, headaches, epilepsy, or TIAs. To date, the underlying mechanisms of Moyamoya disease have remained to be fully elucidated. But certain studies have indicated that genetic factors may be an important component of its development. Cerebral angiography is the best approach for diagnosing Moyamoya disease. However, with technological advances, non-invasive techniques are increasingly used to accurately evaluate Moyamoya disease. Moyamoya disease is commonly treated via surgery, and an increasing number of patients are benefiting from the intra and extracranial revascularizations. Post-op Moyamoya disease.
In the first post-op picture, you will see a young man that has Down syndrome that is post-op Moyamoya surgery in his brain. The second picture is a woman post-op Moyamoya surgery. And then the third picture is inside the brain of a patient with Moyamoya disease fibers in their brain, also known as a bypass low flow between the STA and MCA at the left side in a patient with Moyamoya disease. The end.